Hello, my name is Dr. Anna Chesnakova. I am a naturopath and nutritional therapist. For those of you who don't know me, I was initially graduated as a medical doctor, but could not complete my postgraduate training due to family commitments. I have got 4 children and very busy husband. Nevertheless, I'm very happy that I can practice functional medicine here in my clinic in Loughborough and help people to achieve better health, better energy level, better vitality, which enables them to fulfill their life ambitions. So what is the difference between conventional medicine and functional medicine? So if you go to the medical doctor, they assess you and they use medical tests to see whether your symptoms fit into a definition of a disease. And if they found disease, they use medication to treat this disease. In most of the cases, it is symptomatic relief. So if you have fever, they give you medication to combat this fever. If you have inflammation, they give you anti-inflammatory drugs or steroid drugs to just calm down this inflammation. There are a few exceptions though. If you have infectious disease, they give you antibiotics which treat exactly the root cause of a disease. So whereas functional medicine is trying to identify why in the first place you developed your problem. So what were the predisposing factors, what were triggering factors, and what is in your current lifestyle, diet, keep maintaining your disease condition. So if we use analogy with a garden, in most of the cases, not all the time, but in most of the cases, conventional medicine is just using scissors to cut the tops of these weeds in your garden, whereas functional medicine specialists are trying to weed it properly, to identify the root causes, like the roots of those weeds, and to try to remove those root causes or roots of your weeds, if you will, to help you to combat your disease conditions. So whereas in this country we are not allowed to say that we diagnose, treat or prevent disease, we able to identify imbalances in your body, in your lifestyle, in your diet, which contribute into your disease state. And at the end of the assessment, and if you decided to have functional medicine testing, based on those information, functional medicine works as a detective to detect of those predisposing, triggering and maintaining, perpetuating factors, and then creates an individualized, tailor-made protocol exactly for you, taking into account all your environment and lifestyle to help you to identify and remove these factors contributing in your disease state. I would like to present you an example how conventional and functional medicine will deal with the same condition. So I keep seeing same picture ever and ever again. Usually female comes with a recurrent thrush infection. If I start my assessment, I see that they also have got fatigue, they've got usually anxiety or depression, and these are sometimes very young individuals. And what I hear from them, if they go to the conventional medical doctors, doctors do take a test and identify, yes, you have candida infection, for example. They prescribe topical, sometimes oral antifungal medication to address this candida. And what is happening? Those ladies usually have very temporary relief with their condition, and therefore how they ended up seeing specialists like myself. So Apart from medical doctors, what we do, we are trying to understand why this person has recurrent thrush. And if we see the definition of Candida albicans, we can see in description that this is commensal opportunistic microorganism which lives on mucosal membranes and is usually harmless. But when opportunity arises, Candida may cause a problem, which is most often thrush infection in vagina or in esophagus, sometimes on the skin. And so what gives this opportunity to Candida to thrive? Medical doctors can identify, but usually they don't go deeper into those details and don't usually help a person to identify why their body gave the opportunity to Candida to thrive at the first place. And most of the frequent predisposing factors allowing to Candida to multiply: A, abundance of food, which is high sugar diet, because Candida thrives on sugars in your gut. So if you consume cookies, if you consume lots of sweets, candies, if you drink soda, if you eat lots of white bread or white rice or potatoes, this all convert into sugar into your body, and this all feed Candida. Sometimes person has got imbalanced blood sugar levels, so even if pre-diabetes, which predisposing them for thrush infection. So this is one factor, two factors. Another factor is reduced immunity, and frequently like thrush infection in the mouth or esophagus can occur with HIV infection or cancer treatments when a person's immune system is suppressed. So therefore, when client comes to me, I'm trying to understand why and to identify those particular contributing factors which allow this Candida to thrive. So whether it is imbalanced blood sugar, whether it is pre-diabetes, whether it's immune deficiency, whether it is cancer, whether it is immunosuppression. So I'm not diagnosing their disease, I'm just trying to identify those contributing factors, because there are two approaches. Even if person comes, sometimes they only want me to prescribe them a supplement, which is not much different from doctor's approach, because doctors give medicine and I give supplement to address those Candida. So this is the same approach. It is a pill for a nail without going deeper, and therefore this will have only temporary relief. It won't be as effective. So my advice is for such clients, if you really want to get rid of your recurrent thrush infection, then we need a proper assessment, proper history. We need to take functional medicine test, which will give us an idea what are imbalances in your body and help us to identify those imbalances to give you long-term relief. Also, I keep hearing from those clients that there is a history of antibiotics use. It's either one or several prolonged courses of antibiotics, such as for acne, for example, or multiple courses of antibiotics, such as, for example, for recurrent UTIs, urinary tract infections, or recurrent otitis, or recurrent tonsillitis. And what is happening? These antibiotics, whereas helping us to treat a disease, they also kill off good microbes in our body. And the role of good microbes, or microbiota in our body, is to help us to digest food, to help us to produce vitamins. They also can synthesize neurotransmitters. Therefore, in such clients, some sort of mental or emotional disturbances is not unusual. Also, good bacteria compete for food with bad bacteria, and also they secreting some chemicals which suppress bad bacteria and candida from multiplying, and therefore keeping those pathogens in check. To illustrate what I just have said and to discuss with you the most useful test for people with chronic conditions, I would like to give you a real case study from my practice. So this person was having recurrent thrush infection, irritability, severe PMS, psoriasis, balance issues, low immunity, poor circulation, fatigue, hay fever, low hemoglobin in blood, and paresthesia. And this person have done this test, which test for the microbiota, for the ability to digest, and for the potential pathogen and non-pathogenic microbes in the gut. And it was found that this person had candida, but it wasn't only one type of candida this person had. This person had several types of candida. So this person wasn't having any beneficial bacteria growth on the stool test. This person had additional bacteria, 1, 2, 3, 4, 5, and this additional bacteria was found in high numbers. And what can happen if there are high amount of additional bacteria, it also gives immune system a burden. And mycology results show that this person had 1, 2, 3, 4 types of candida. Although they were in smaller numbers, but these 4 types of candida most likely were contributing into this recurrent thrush infections, and all of those bacteria were also contributing into the fatigue, into poor immunity, skin issues, and the mood issues. Why? Because if this bacteria lives in our gut, where most of digestion should happen, then this bacteria interferes with our digestion and absorption, and therefore it prevents us from getting vitamins and minerals and other nutrients from food. It's literally stealing those nutrients from us. And not only that, they stealing those nutrients, they multiply in numbers, but these are living creatures, and these living creatures make waste. And this waste is getting absorbed into our circulation. Studies show that up to 30% what is in our blood comes from bacterial, from bacteria and from microorganisms living in our intestines. So these bacteria were actually poisoning this person, depriving from the nutrients and poisoning nervous system, and therefore this person was having some emotional disturbances and skin issues and low hemoglobin, because they were literally stealing those iron which this person was consuming, and this person was consuming meat on daily basis. So we also conducted this test also checks not only what microbes this person had. This test also checks the sensitivity of this bacteria and yeast to pharmaceutical and natural agents. So it was found that this first type of candida was more sensitive to garlic and undeselenic acid, and it wasn't sensitive enough to caprylic acid, to plant tannins, to uva ursi, and it also gives the same sensitivity results for all these 4 types of candida which was found. But this is not a full story. We also conducted this test, which tests for vitamins and minerals in the human body, and Although, as I said multiple times already, it's not to diagnose a disease, but these tests are sensitive enough to pick up imbalances in the human body. So we are not diagnosing disease, but we are identifying contributing factors which enable this candida to multiply in this person's intestine and create all those sorts of symptoms. And we also checked for the downstream effects. So it was clear that these microbes identified in candida prevent this person from absorbing nutrients and minerals, although they were present in the diet. And the downstream effects was found. So this test called the optimal nutrition evaluation, and this test in urine and concentration of vitamins and minerals. And it uses traffic light system. If they were found in optimum amount, they would be plotted, the results would be plotted on the green area. If it is suboptimal amount, they will be plotted on the yellow. And if it is like very imbalanced or very insufficient from the optimum health point of view, not from the disease point of view, but from optimum health point of view, they would be plotted on the red. And can you see how many came on the red? There is only one nutrient which came on the green zone, which was in balance. There were 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 nutrients in this person were in balance. So no wonder this person had issues with mental state, with emotions, with fatigue, with skin issues. So there is a clear explanation why this person was suffering. So this person had tailor-made protocol. This person followed dietary advice, supplement advice, lifestyle advice, and a few years down the line, this person had a significant improvement in symptoms. So out of 11 symptoms I mentioned, only 4 symptoms now remained, and some of them significantly improved. Is it ideal? No, it's not ideal. But to have 4 symptoms out of 11 symptoms, and also some of them greatly improved, I think, and this person thinks, it is a great achievement, and this is great success, although it's not ideal, but this is a great success. And this enables this person to have much higher quality of life and much fulfilling life, have more energy for the family life, for the social life, for the professional life, everything. So anyway, let us have a look how this person has improved. So this was like a follow-up testing after a few years. Although this person still has got additional bacteria, but this is considered due to this person is having low hydrochloric acid, which is now getting addressed. So hopefully this person in the future would have less bacteria. But look here, Candida albicans was found only 1 species of Candida out of 4 species previously identified. So I think this is great improvement, and this person thinks it is a great improvement. And tests show us, this give us objective information. This person objectively improved from the testing point of view. And if we check downstream effects, so this was the follow-up testing of the vitamins and minerals. Look now what is happening, like almost everything, like most of the things are now imbalanced. So 1, 2, 3, 4, 5, 6, 7, 8, 9 nutrients are balanced in an optimum amount. There is only one which is like greatly in a big imbalance, and 1, 2, 3, 4, 5, 6, 7 in suboptimal level. So there is still work to do. But as I said, this improvement enabled this person to have more energy, to reduce, to have almost 60% improvement, and to have much better quality of life. So although these tests are they can be expensive, so test starts from £300, and this gut test cost £355. The most expensive test costs £605. Yes, it costs money, but this is your life, so it is up to you to decide whether you would like to invest this 300, 600 or 900 pounds into this testing, whether it's worth it, whether you had enough suffering. So there are two types of services I can provide. I can provide you with a functional medicine service where we will dig down deeper and using this functional medicine test to find what led you to have these symptoms and then to address those symptoms, as opposed to some clients who come and want me to recommend them a supplement to address those symptoms. So in this video I was trying to explain how complicated it is, and if we will be using a supplement without testing like it was used a century ago, it can take a long time, because as you can see, there are multiple agents on the market, multiple different supplements, but can you see that this candida which you are having or whatever you are having might not be sensitive enough? And how do we know without testing? Without testing, it's just a guessing. Only one God will know what is sensitivity of your microbes in your gut, in your vagina, in your mouth. And so if you only want me to prescribe a supplement, yes, I'm happy to recommend it to you, but it might take ages for you to improve, because without this testing, am I going to know what your microbe is sensitive to? No. So in 21st century, the best thing to do to get from point A to B, from the point where you are suffering now, from the point where you will be having less symptoms, better mood, better energy, you will stop having those recurrent infections, so hopefully the frequency will be lessened. So from getting you from point A to B as quickly as possible and as efficiently as possible, I recommend to use functional testing. And also in the long term, yes, you will invest into this testing, like as I say, 300, 600, 900 pounds. It depends from your condition. But potentially you will be saving money, because if we will be just trying one supplement, then another supplement, then third supplement, and we will be trying to give you some nutrients and minerals, but without this test we will be guessing what is the right supplement, what is the right dosage for you, what is the right duration of protocol for you, and it will take ages, and it is potentially waste of your money and time. If you have this time and if you are happy to go like it used to be in the 19th, 20th century, that's fine, that is your choice. I'm happy to support you, whatever your decision is. But my job is to explain you that there is a better way and quicker and most efficient way, because potentially, yes, you will invest those money today, but long term it will save you time and money. And especially if you haven't got this time, I have got clients who will be having exams like in the next months, and they don't really have this time. They don't really have time to play with these supplements anymore. They need to improve quickly and efficiently. And so it's up to you to decide what you want to do. I have a very interesting case recently. So one of the clients came and they only want a supplement. But as a part of my job, I'm asking clients to field questionnaire, and sometimes they need to calculate their score and to present me with the overall score. And I had a look at this questionnaire. This person came with recurrent thrush infection, with recurrent UTI, with anxiety, with depression, with fatigue. So they have 5 symptoms, and they will be having exams in 2 months' time. And then they refused testing. But when I calculated their score, recalculated the score, I realized like 70% of their answers are wrong. What it means to me that this person, I don't know exactly whether they concentrated, whether they paid attention, but if I assume that this person was paying attention and concentrating on calculation, that having 70% of their calculation wrong makes me really worried about their exams. So they will be having A levels in 2 months' time, whereas they cannot figure out just arithmetics. So this makes me very frustrated when the clients refuse testing, because as I said, I can see much bigger picture than they can see, and I'm trying to do my best to explain this to them, but at the end of the day, this is their choice, what they want to do, and my job is support them in their way to better health, whatever their decision. So, if everything what I just said makes sense to you and resonates with you, if you're having some chronic problems, autoimmune conditions, recurrent infections, fatigue or mood issues, or problems with your memory, with your concentration, please get in touch with me for this functional medicine appointments. Just type in Google Dr. Anna Chesnakova, naturopath or nutritional therapist, and you will be able to find my contact details. So the current charges are, I charge £200 for the initial assessment, which will take up to 2 hours. And the follow-up consultation will be charged at £100 per hour. So this is where I will dig down deeper and trying to identify what imbalances contributing to your symptoms and help you to address those imbalances and get better, have more energy, more vitality, and improve your symptoms. There is another type of service which is supplement only, and this will be charged at rate £50 an hour. And I can explain the difference, because for functional medicine appointment, every hour, every contact hour I spend with a client, which is 2 hours for the initial appointment, will then lead to the same amount of hours working on the client's questionnaires, program, researching the science, ordering the test and reviewing those tests, potentially speaking to the laboratory with regards to the test results, potentially speaking to the supplement company and checking interactions between supplements and interactions with the drugs person is having. So effectively for £200 you actually have got 4 hours of my working time, which works out as £50 an hour. Whereas if it is supplements only advice, I will not do this work, like I will not order the test, I will not write any referral letters, and you will have to keep your own notes. So that's the difference. So if you would like me to help you, to assist you in your journey to better health, please get in touch with me. I would be more than happy to share my knowledge, my expertise with you. And thank you very much for watching my video. The best of health and best of luck to you.